Hello everyone. This is the Pharmacogenomics second lecture. It's highly based on Pharmacogenomics 1, so if you haven't listened to Pharmacogenomics 1, please try to listen. First, we can now simply understand and define what is the meaning of genomics. Pharmacogenomics has two parts, so what is the meaning of genomics? It is the study of the entire set of genetic instructions found in a cell. As we explained in Pharmacogenomics 1, we have a genetic map. So this is the study of genomics. It's the studying of the genetic map of human beings. So what is pharmacogenomics? Pharmacology simply means the use of the drug. So what is the meaning of pharmacogenomics? It's a branch of pharmacology concerned with using DNA and amino acid sequence data to perform drug development and testing. So it's important before testing to define the exact genetic map and to try to understand why the drug had that kind of action in this individual according to its genetic map. So to understand more about pharmacogenomics and how they are important as an application in pharmacology cases, in this lecture, I'm going to describe about two examples. The first one is the ultra-rapid metabolizers of codeine, and the second one is the TPMT polymorphism and 6-mercaptopurine drug, which is an oncology drug. Don't be confused about the complicated name. We are going to discuss and clarify the example itself. First, it's the ultra-rapid metabolizers of codeine situation. Before going into this case, I would like to simply explain. If you know about medical terminology, you can easily understand what is the meaning of ultra-rapid metabolizers of codeine. Ultra always means the best or the fastest, okay? Rapid is also a meaning of a quick one, okay? Rapid or fast. So ultra-rapid means the most rapid or the highest speed. Metabolizers means the molecules that metabolize the drugs. What is the drug in this case? It's codeine. So now we understand these metabolizers are acting or working very, very, very fast to break down codeine. So what is our example? Let's discover. A healthy 2-year-old boy did elective adenotonsillectomy. What is the meaning of adenotonsillectomy? If it's first time for you to hear about it, so let's use the rule of the medical terminology. Just divide the words into simple parts and try to understand individually. Adeno means a gland. Tonsil means the tonsils. We have the tonsils here. Ectomy means removal. So if we understand removal of the tonsil gland here, it's very common for children because they have repeated infection, so these glands are enlarged and they prevent the boy from breathing effectively and it affects their growth. So this operation is very common in children. What is the meaning of elective? It means it's not an emergency. So the boy went to the doctor and the doctor decided, oh, let's remove the adenoid gland next week. So we chose the time for this operation, so it's called elective. So we have a 2-year-old boy who did an elective adenotonsillectomy. After surgery, the guidelines and indications has instructed the boy to take 10 to 12.5 milligram of codeine. Codeine, if you don't know this drug, we have a group of drugs called opioids, with the major drug or the main member of this group is the morphine. Of course, you have heard about morphine. It's a very strong painkiller, but at the same time, it's a very famous drug for addiction. You know, drug addicts who always take the medicine to relieve their pain or just for abuse. It's an incorrect way for using the drug. Codeine is, as we say, it's the little brother of morphine. It doesn't have the same high effect of morphine, but it's very effective in decreasing the pain level. So it's medically used after operations mostly for children. So this is the recommended usual dose of codeine is to take 10 to 12.5 milligram of codeine after the operation to decrease his pain. But surprisingly, 2 days after the surgery, the child died. Why he died? He didn't have any complication from the surgery, and this is the usual dose of codeine. The investigations done revealed that the codeine level and the morphine level was so high. Morphine? Why there is morphine here? And also it has a toxic level. So let's explain what happened. The codeine is metabolized by an enzyme called cytochrome P2D6. We have a group of metabolizing enzymes in the liver called the cytochrome system. It has many members. One of them is the cytochrome P2D6, which is responsible for the metabolizing or breakdown of codeine to be eliminated from the body. And this enzyme has 3 copies. Okay, 3 copies of the cytochrome P2D6 is the ultra rapid metabolizer copy. It means these copies of the enzymes work very, very, very fast. So they break down codeine very, very, very fast. But what is the problem of that? It should decrease the effective action of codeine. But what happened? As you can see, there are 3 types of enzymes which break down codeine. Cytochrome CA4 and another enzyme and cytochrome 2D6. What happens if we have a very, very fast growing action of cytochrome TD6? Most of the codeine will be metabolized by this drug and by this enzyme, And this enzyme will change codeine into morphine. And as we said, morphine is dangerous. It's not simply like codeine. It's a very strong drug which can decrease all the activity of the central nervous system, and if it affects the respiratory system, decrease its action. So the people usually die from inhibition or suppression of the respiratory center in the brain. So the child cannot breathe, so he died. So when we have extra rapid effect from this enzyme, then we have a very, very high level of morphine which should not be there, and so the child died. So now we understand how a single SNP inside the gene of the cytochrome P2D6 affected the pharmacokinetics and metabolism and makes that enzyme working so fast, so it breaks codeine into morphine very, very, very fast, exceeding the level of morphine that should be present, and so the child died. That was a very famous example for codeine and the effect of SNPs. Another example is also a change in the morphism of an enzyme called TPMT with a drug called 6-mercaptopurine. 6-mercaptopurine or 6-MP is a drug used as a chemotherapeutic agent. It means drug used for treatment of cancer with acute lymphoblastic leukemia, a kind of blood cancer in children. How it is metabolized? The mercaptopurine drug has its mechanism of action, the usual mechanism of action as an anti-cancer drug. It's like a false copy from another nucleotide that the DNA uses to build up the cell. as we all know, cancer cells are replicating and dividing very fast, and they grow very fast. So if we want to treat that cancer, we should decrease the level of replication or duplication of the cancer cells by killing them. So how in this case? We try to kill them by the 6-mercaptopurine. We give the cell a false copy of the 6-mercaptopurine. So the DNA which the cancer cell is trying to make to divide into 2 new cells is a false DNA. So these cells doesn't divide. So that's how we treat the cancer. Okay, so this is the primary action of the mercaptopurine. What happens if we have a polymorphism? This 6-mercaptopurine is normally metabolized by the TPMT enzyme into methyl mercaptopurine, which is the inactive form, and so the body can get rid of this 6-mercaptopurine, so it's eliminated outside the body. What happens if we have a polymorphism in this enzyme? The TPMT, the 6-mercaptopurine, is still active and it cannot be broken down or metabolized to the inactive form. So we have more 6-mercaptopurine. So more cells are using the 6-mercaptopurine. And what is the problem? Maybe you think, okay, this is good for the cancer cells, but we have naturally occurring cells that grow very high level, like the cells in the intestine, the cells in the hair, the cells in the blood. These kind of cells are naturally dividing very fast because it's continuous state of regeneration. Okay, so always the cancer patients tells they lost their hair, they have diarrhea, they have anemia, because all the anti-cancer drugs also affect the rapidly dividing cells in the body naturally occurring. So what happens if this mercaptopurine is used by other cells? We get very high toxic level, and the naturally dividing cells start to be affected by this drug, leading to severe anemia, severe diarrhea, and many toxic side effects. So this is the important how the single SMP in the enzyme TPMT, which is responsible for breaking down of the 6-mercaptopurine, can affect the patient. Here, to more clarify, this is the wild type or the normal type of the TPMT enzyme. Normal people have 2 copies, okay, of the TMPT1. But with the slow metabolizer or the non-metabolizer, they have the copy called CA, 3A, and 3C. And these 2 copies are not effective in breaking down the 6-mercaptopurine because they work so slowly. So the TMPT polymorphism, when we have rapid metabolizers, it's the opposite side. We need high dose of the drug because it's breakdown very quickly. But the most dangerous is the situation where we have the slow metabolizers. So patient will have high risk for developing fatal neutropenia. Fatal means it's a dying case. I mean, the patient can get attack of neutropenia, which leads him to death. What is neutropenia? Neutro means the white blood cells inside the body, and penia means decreasing. So decreasing the white blood cells inside the body can lead to serious, dangerous side effects. As you know, the white blood cells, they protect us from the germs. So if we don't have any white blood cells, our body is exposed to many infections which can lead to our death. So in these patients who has a slow metabolizing TPMT polymorphism, we should only give up to 15% of the normal dose we used to give to other patients. For example, if we give 100 milligram of this drug, we should only give 15 milligrams of this drug. Due to accumulation of excessive thioguanine nucleotide in hematopoietic cells, it means the cells making the new red blood cells. Also, the risk of secondary malignancies, it means other kind of malignancies can also occur due to the formation of a bad or toxic DNA. So in conclusion, now we can summarize how pharmacogenomics is important for us as a pharmacologists and as a pharmacists. First, we can categorize the human disease at genome level. So which disease is a genetic one and which is not a genetic one. Identification of disease related to genes and specific drugs. So if we know that certain kind of disease happens due to a single SNP, so we can totally avoid this disease if it's caused by the drug and advise the patient not or never to use this drug. Can adapt primary and secondary preventive measures. It means if we know that SNP can lead to side effects if the patient is taking this drug, when we stop this drug forever, we cannot get this disease. Maximal patient care and minimum adverse drug reaction. Of course, the dream for all the pharmacists and the pharmacologists is to never see an adverse drug reaction from the drug, or to make and develop 100% safe drug. So if we know and study a lot about the SNPs, if this drug has a genetic effect, we can totally decrease the adverse effects. So again, our target is to personalize the drug or medicine. So coming to an end for this lecture, I want you to remember again, our goal is the individualized treatment with drugs and the 5 rights. You have to choose the right dose of the right drug for the right indication for the right patient at the right time. So please always check with your patient that he is taking the right dose at the right time, and always revise and check with the treating doctor for the right drug indication and it's suitable for this patient. And thank you so much for listening to the pharmacogenomics lectures, and I hope you understood. Thank you.